Hi friends, I am Dr. Pratap Singh Rathod. I have done Indian Pharmacy Medicine. In today's video, I continue with psychotropic drugs. In that, we have discussed about antidepressants and uh, neuroleptics. So, in this video, we will discuss about psychedelics or hallucinogens. Psychedelics groups are substances that produce alteration in the environmental awareness, while the individual maintains the capacity to recognize that what he is experiencing is not real. So, here the person experience some environmental changes, like he sees some things or hears some things, but he is aware, he recognizes that whatever he is experiencing is not real and he experiences that is the psychedelics. Such person is usually fully awake, alert and oriented, but confronted with varied perceptual abnormalities and various sensations. Sensory perception and thought process are grossly distorted, and also mood is altered. Reality, that is space, time, bodily dimension, is distorted, and a feeling of depersonalization makes the patient feel separated from the situation. There may be hallucinations produced by drugs, usually have some environmental stimulus providing the basis for illusion. Most of hallucinations are visual in conditions, so they can cause hallucination or illusion. Hallucinations are without they occur without stimulus. So if there is no stimulus is present, that is hallucination. Hallucination where the person sees some objects without any stimulus, that is hallucination. Illusion, on the other hand, is something with there should be some form of stimulus, like rope is present where the person interprets it as snake, that is the illusion. Hallucination is there is no object is present but may visualize some person is standing in front of him, though there is no person is present, that may be seen. Occasionally blending of sensory modalities, that is synesthesia, where some object is or sound is interpreted, misinterpreted, may be noted. Profound philosophical thoughts, deep introspection, self-examination, or religious overtones may be prominent components of the psychological experience. Examples include LSD, lysergic acid, cannabis, mescaline, dimethyltryptamine, psilocybin, psilocin, which are obtained from mushrooms, psilocin, peyote, pencyclidines, which are important hallucinogenic drugs. Coming to action, psychedelic groups of drugs involve various neurotransmitters in us. LSD involves the serotonin system and tropine alkaloids, which like atropine, scopolamine, and hypsamine have anticholinergic effects. There is a psychic dependency only, and there is no abstinence syndrome. The person is psychically dependent, but so because of that, there is no withdrawal symptoms will not be present. Symptomatic symptoms include dilated pupils, tachycardia, tachypnea, hypothermia, diaphoresis, pallor actions, dizziness, weakness, hyperactivity, muscle weakness, ataxia, altered mental state, and coma. Parasympathetic symptoms include salivation, lacrimation, diarrhea, nausea, vomiting, bronchoconstriction, and hypertension. During hallucinations, sensory perceptions are intensified, colors seem brighter and more clear, sounds seem excessively loud with exaggeration of detail. The individual feels sense of depersonalization, sense separation from the environment. Benzodiazepines, barbiturates, amphetamines can produce perceptual changes during withdrawal. Alcohol in excess, alcohol deprivation can also cause hallucination. Other than psychedelic drugs, these drugs can also produce similar to hallucination can also produce from these drugs, like benzodiazepines. Alcohol in excess can cause alcoholic hallucinations. Barbiturates can also cause some form of hallucination when there is in case of when they are withdrawn. Also, alcohol deprivation, that is alcohol withdrawal, can also cause delirium tremens, which is can cause psychedelic effect. Coming to common example, which is the first is the LSD. LSD or lysergic acid diethylamide is a colorless, tasteless, odorless, semi-synthetic compound, the lysergic acid portion of which is natural product of the ergot fungus Claviceps purpurea. So Claviceps purpurea, if they are usually grown on the has a fungus on the cereals. So they're in the cereals like wheat, rye, beet. They grow on those wheat and they are mixed with the uh, mixed with the grains. So the ergot fungus grows on them. It is taken orally. Rarely it may be smoked or injected parentally. It commonly taken as liquid on sugar, saturated sugar cubes soaked into blotting papers, capsules, or blue pills. Action: it is a powerful antagonist of serotonin and can also mimic its action. So it it acts against the antagonist of serotonin. It is absorbed from gastrointestinal tract and considerably amount becomes bound to blood proteins. It is rapidly distributed throughout the body. Highest concentration is seen in the lungs, liver, kidney, and brain. Symptoms: the dose is required to produce psychotropic effects, that is called as a trip, is about 100 to 200 micrograms. So usually the person who consumes LSD defines that they have went to it like a trip, psychedelic trip. The trip usually occurs after half to 1 hour, peaking after about 2 to 6 hours and fading after 20 to 12 hours. So it starts with half to 1 hour and peaks about 2 to 6 hours, and afterwards it fades up to 12 hours. The effects depend on very much on the individuals and on the circumstances, with the same user having different symptoms like bad, good, or good trip. Some users experience bad trip consisting of an acute panic reaction instead of psychedelic experience, which may last for 8 hours. So it may be a bad or it may be a good experience. During this period, there is paranoid delusions, violent behavior, automatism, or depersonalization may also occur. Symptoms are dry mouth, sweating, dilated pupils, tachycardia, hypertension, extreme mood changes, visual hallucinations, alteration in time perception is also seen. Altered changes in vision, hearing, floating feelings, illusions, sensation of synesthesia, seeing, smells, and hearing colors can also seen. The action persists for 12 to 18 hours. Tolerance develops in 2 to 3 days with daily dosing up, but rapidly disappears if the drug is withheld for 2 days. Adverse effects of chronic usage: it can cause depression, panic attacks, schizophrenic episodes, and psychosis. Fatal dose is about 14 mg. If taken in the last dose, it can cause death. Medical importance: at height of effects of the drug on the mind, individuals becomes violent or panic stricken, can attack some others, urge to kill or hurt himself from disregard of reality and thus normal consideration of safety. So they can either kill or can also harm themselves in the way of trip. The feeling of being able to fly under the influence of LSD can lead to users to jump out of the windows also. The person feeling of flying, they may try to jump and may lead to death. Recovery stage: there may be apprehension and distraction. There is not obvious to onlookers. Biological half-life of LSD is about 3 hours. It does not cause chromosomal breakage and is not teratogenic, and it mainly recovery is present. There is a flashback phenomenon which is commonly seen in LSD. This may occur days, weeks, or even months after the ingestion of a dose, and the person experiences a recurrence of the emotional and psychological aspects of previous LSD trip. So these are seen after, even if the person not consumed. Sometimes the same effect is seen after the person's trip. The flashback symptoms occurs most frequently with the abuse of psychomimetics such as LSD, STP, tryptamines, mescaline, and psilocybin. These delayed recurring symptoms may lead to eccentric behavior, suicide, or even homicide. Even though the person may not consume because of long-term effect or long-term consumption of LSD, the person may have flashback symptoms which may lead to some erratic behavior, which may lead to suicide also. Treatment: low dose of anti-anxiety drugs and IV with repeated dosage is given. Prolonged talking, known as talking with the person down, which may extend to 12 to 14 hours. So usually talking with this person with prolonged may also helpful in decreasing the symptoms. Then psychotherapy is one form of way to relieve the person. Other psychedelics includes amphetamines, cocaine, ecstasy can cause ecological dependence but are not major physical withdrawal symptoms. There is CAT, which called catalysis, is achieved for a stimulant effect. It consists of cathinone, which is the main component, which produces effects similar to those caused by amphetamine. Ecstasy is also one form of psychedelic, which is a 3,4-methylene dioxymethamphetamine, is a stimulant and hallucinogenic properties. It is also known as club drugs or rave drugs, commonly sold in the parties. A dose of 75 to 100 mg produces effect within half hour to 1 hour. In addition to general symptoms of stimulants, trismus, spasm of muscular manifestations, and bruxism, that is grinding of teeth, can also occur. Next are steroids. Again, steroids also can have psychedelic effects. Anabolic steroids taken orally by injection produce mood swings, aggressive behavior, depression, and paranoia. Next is peyote. peyote, it is a cactus. It is also has some psychedelic effect. The top of the plant, so this is the peyote for cactus which is grown in deserts. The top of the plant consists of round buttons which are cut, dried and chewed. The active principle is mescaline. This mescaline has psychedelic effect. The effect lasts for 8 to 12 hours. It can be prepared synthetically. Taken orally, it produces trance-like state. Overdosage will produce psychosis and even death. Next is psilocybin and psilocin. These are all obtained from mushrooms. They are alkaloid present in the mushrooms. Their potency is less than that of LSD. Psilocybin is made synthetically. The effect can last about 6 hours. Overdosage of psilocin can cause death. Next form of psychedelics are anti-alkali nitrites. Alkali nitrites such as amyl nitrate are used as euphoric relaxants. Inhalation of vapor causes headache, dizziness and flushing. Excessive use may produce methylglobinaemia by injection and inhalation. It can also cause acute psychosis and violent behavior. Then is phencyclidine. It is taken orally or smoked or tobacco by injection and inhalation. It can cause acute psychosis and violent behavior which can lead to death from trauma. Rarely sudden death can also occur. So again, psychedelic is also one form of hallucinogen. These are my reference. Thank you.